I had torn my labrum in the front, the back, and had some instability. I think it happened over a few different times. I had torn my labrum when I was younger. Then I was mucking around at a gymnastics place, kind of felt something again. And then I was showing someone how to do a bar muscle up and didn't warm up properly and overdid it. Couldn't walk on my hands anymore. I couldn't do like handstand push-ups. I couldn't really work out overhead. I couldn't lift my kids up. There's a tree in our yard that we play in a lot. I couldn't climb the tree. I'm 40, just turned 40. My first doctor said, oh, you're on the upper age of where I would recommend the surgery. Mostly we'll do these other things. So I wanted a second opinion. I came to Dr. Owens and he was telling me he thinks I'm fit for this procedure.
So she had a tear of the labrum, which is the kind of the gasket that goes around the sockets. And if you have a tear in the labrum in certain provocative positions, you're gonna have pain when the humeral head or the ball hits up against that gasket on the socket. Also, in her case, she was unstable, so her shoulder was kind of coming out the back. Playing with the kids, housework, any sort of overhead activities around the house bothered her, in addition to sports. And sporting activities were a big part of her life.
I wanted to be able to play fully with the kids, getting full mobility, full range of motion, full strength. I just didn't want to have any limitations. I felt really comfortable when I came to Dr. Owens, knowing that I could make a full recovery if I did the work. I've never had surgery before. Dr. Owens told me this is actually a really pretty simple procedure. It's the recovery that's really arduous.
Quality therapy is the keystone to a great outcome. The carpentry has to be right, the surgery, putting the labrum back in the right place has to be done correctly, but I only get 30 minutes to an hour with these patients. This is a pretty fast repair. The next 6 months, that's really with her and the therapist on an everyday basis.
I had requested that I be treated more like a professional athlete because I wanted to get back into it quickly. He was really responsive to that. I think different fit for different people depending on what's right for them. Dan Bean has been my physical therapist the entire time. I've stuck with him because he's just really good. He makes me feel comfortable. He listened to my goals, set a plan. I promise to be a very good patient and do all the work. I can still feel that it's not 100%, but it's almost there. I would say I'm 90%, and it's been just about 6 months. I did my first handstand walk here because I wanted to see if I could do it and asked him if it was okay. And so he wanted to see it, and yeah, felt good.
I'm always in awe of my patients when you see what they're able to do. And that's why it's really important before surgery to have a thorough understanding of what exactly they mean by their activities of life or activities of sport, and have to have an understanding of what that sport is and what it entails.
Little things, right? Like I mentioned the tree in my yard, it's high, so I have to like press down to jump into it, and I can do that with confidence now. Whereas before, everything I was doing, I wasn't quite sure if it was going to hurt or not, or if I was going to have the stability or not. And now I'll go out paddleboarding, I'll play with kids, I'll play tennis. I can play tennis, which I hadn't played in about 20 years, but I love doing. I have a puppy, and I can play tug of war without having to like really protect my arm.
It's certainly satisfying to see an athlete get back to activity. That's why we're here. Certainly the professional athletes have their career, money riding on it, but all our athletes have sports that are hugely impactful in their personal life and are extremely important to them. And we do have to customize and tailor each treatment option to help satisfy their ability to just live a normal life, and in addition to be able to perform athletic activities. It's been really fun and exciting to watch how she's been able to recover from this, and we're very proud of her and we're thankful for her hard work.
Don't give up. Figure out what your goals are and then make your decisions based on those goals. Don't just give up because you think you're a little bit too old or you're a little bit too out of shape. You think it's going to be too hard, because it's a very limited amount of hard. The first 2 weeks were pretty humbling, but after that, it's worth it to get back to where you want to be.
Yay!